Bismillahirrahmanirrahim. We have been discussing on hair transplant surgery for many days, and today we are discussing about swelling. Swelling is of two types. It is post-operative swelling. It comes usually after 48 to 70 hours, 72 hours of surgery, and usually seen on the forehead and periorbital as well, around the eyes. How does it happen? It actually, when we inject the fluid in the scalp to elevate the scalp, or putting the hair in, or making the slits in the scalp, because we need to put the hair in upper two layers of skin. We want to avoid putting hair below the second layer, like below the dermis, because the hair usually grows and remains in the dermis, and it is taken from the dermis and put back in the dermis area. We don't need to put down the dermis, and this is scientific. And what we do is we put fluid underneath the dermal layer, in the subcutaneous layer, to elevate the dermis and epidermis, okay? And that fluid actually comes down while the patient is sitting or doing something like bowing down, or doing a job on the laptop, watching the movies, and etc., etc. So it can come down, but the treatment of that fluid is already been done when putting in anesthesia during hair transplant surgery. And we give some injection during anesthesia, that is triamcinolone. And triamcinolone, actually what does it do is it absorbs the fluid rapidly from the scalp inside the body, okay? And but in some patients who they have loose skin, and the fluid finds a way down with the gravity and moves down on the forehead, and then around the eyes, it can cause a swelling. Obviously it is a temporary swelling, and the fluid will be absorbed with the passage of time, but it looks very awkward, and sometimes you see the patient gives a look of aliens, and that is embarrassing situation actually. And some of the patients who they are not explained very well by the doctors and surgeons doing a transplant surgery, they get scared of this swelling usually, because they don't know that it can happen, and they think that it is because of some sort of infection or some sort of other things, and inflammation, and they go into the anxiety and keep calling on to the doctors even at midnight. And patient, the solution is patient should be explained. Keep calling patient for 3 days post-operatively in the clinic, so that if you observe any fluid coming down, you can push it on to the sides and other things, okay? This is the solution to it. And there is no need of giving, to me, there is no need of giving any steroids or any oral steroids, because I don't give them. Where you need to call the patient in clinic every day for head wash, and if you see some swelling, you can push it on the sides. This is the only solution to it. And patient should be explained very well. And while doing an anesthetic, you need to put limited amount of anesthesia, limited amount of fluid inside the skin, so that if there is a less amount of fluid, less spilling will be there and less swelling will be there. In my clinic, 1-2% patient they feel swelling, but we tackle them, we cater them in the clinic, because in my office we keep calling patients every day for 4 days post-operatively to take care of that, because I think whatever the situation is, even if the patient is much educated, he is considered to be an innocent person in the field of hair restoration surgery. He needs to be explained very well on every situation happening post-operatively in coming 3 days or coming 15 days or maybe later on, okay? And we need to keep him aware of everything, okay? And thank you very much, but thing is to me, what should be done is on priority basis, you keep the patient in a direct communication with the doctor, with the treating physician. Thank you so very much.